This video will show the examination of the motor system of the upper limb and also provide a structure for the neurological examination. In addition, it will provide techniques for effective communication with patients. The mnemonic wiper provides an appropriate introduction to the clinical examination. W stands for wash hands, I for introduce, P for permission, E for expose, and R for reposition. In the upper limb examination, exposure should be from the waist upwards and the patient should be in a sitting position.
Hello there, my name is Freya Baird. I'm a final year medical student. Can I just confirm your name, please?
My name is Jane Smith.
Nice to meet you, Jane. Would it be okay if I examined your arms today?
That's fine.
Are you in any pain in your arms at the moment?
At this point, it is important to ask the patient if they're in any pain.
For this examination, would it be okay if we could have a look at your arms, if you could take your gown off for me? Thank you. Would you be able to lie back for me?
Yeah.
Are you quite comfortable?
Yeah, that's fine.
The structure of the neurological examination can be remembered by the mnemonic I TOPCAR. I stands for inspect, T for tone, P for power, C for coordination, and R for reflex. The first stage of the examination is inspection. The student first checks the surrounding environment for clues. Then inspects the patient. Is the patient well or unwell? Is there any evidence of abnormal posture? Next, the student looks for wasting, specifically over the deltoid, thenar eminence, and first dorsal interosseous. Finally, the student checks for fasciculations, particularly over the biceps.
Okay, to start with, I'd just like to have a look at your arms, if that's all right.
That's fine.
Can I have a look at your hands? If you could turn them over for me, thank you. And if you could put them up for me like this. And if you could lean forward. Thank you, you can lie back now.
Tone is assessed by passive movement of the shoulders, elbows, and wrists. More specifically, at the wrists, the supinator catch indicates an upper motor neurone lesion. Tone may be classified as increased, decreased, or normal, and rigidity may be clasped knife, lead pipe, or cogwheeling. The latter is a tremor superimposed on rigidity.
Okay, to start with, could you put your arms
The
up
student
like
assesses
this?
for pronator drift, which is a useful screening examination for upper motor neurone lesions.
Okay, next, I just want to run your arms through a few movements. So if I could take your hand, if you just completely let me take the weight, let your arm go floppy for me.
Sure.
If you could make a fist for me, thank you. And the same on the other side. If you could make a fist for me, please, thank you.
Power is assessed in several muscle groups in the upper limb. It is important to compare left with right and isolate the individual joints being assessed. In the next clip, the myotomes are labelled as they are individually assessed.
I would now like to test the power in your arms and run your arms through a few movements, if that's okay. So if you could put your arms up like a chicken, okay, and don't let me push you down. Thank you. And up like a boxer, and don't let me pull you away. On this side. And don't let me push you in. Okay, this time if you put your arms out and cock your wrists up towards the ceiling, don't let me push it down. And if you could spread your fingers out and don't let me push your fingers in. And again. If you could put them together and put them up towards the ceiling, don't let me push them down. If you could turn your hands over and put your thumbs towards the ceiling. Thank you.
Using the Medical Research Council grading system, power is scored from 0 to 5, as illustrated. There are 3 components to the assessment of coordination. First, rapidly alternating movements, or dysdiadochokinesis. 2, pass pointing. And 3, intention tremor.
Okay, now I'd like to assess your coordination, and again we'll go through a few movements. So first of all, you put your left palm up towards the ceiling, and with your right hand start clapping, and then alternatively turn your hand over, and do that as fast as you can. Thank you. And now the same on the other side, start clapping. Thank you. Now, with your right index finger, you could touch your nose, and then touch my finger, and back to your nose, and back to my finger. And again for me. And same with the other hand.
Reflexes are tested at the triceps, biceps and brachioradialis. The root values are illustrated here.
Okay, now I'd like to test your reflexes if that's okay. So if you completely relax your arms for me. Thank you. Thank you. This time, on the count of 3, if you could clench your teeth for me, please. 1, 2, 3.
Reflex grading is recorded in the notes as illustrated here.
Okay, thank you very much. That's the end of the examination. Do you need any help getting dressed at all?
No, thank you.
Thank you very much. To complete my examination, I would like to assess the vascular status of the upper limbs, do a sensory examination of the upper limbs, and assess the lower limbs.
In the neurological exam, it is important to give clear instructions to the patient. In all OSCE stations, you should emphasise your actions to the examiner and learn the theory underlying each of the tests you perform. It's also valuable to practice on friends and on patients. Supplementary notes on neurological theory can be found at www.osceaid.co.uk.